Hi friends, welcome to the channel, The Nurse. If you are not subscribed to our channel, please subscribe. So here we are discussing about schizophrenia and delusional disorders. Important points to remember. Schizophrenia and delusional disorders, important points to remember. So we will start from here. The main types of schizophrenia are epiphrenic schizophrenia, catatonic schizophrenia, paranoid schizophrenia, disorganized schizophrenia, schizoaffective type. And there are more schizophrenia and the main types are mentioned here. So the main types of schizophrenia are epiphrenic schizophrenia, catatonic schizophrenia, paranoid schizophrenia, disorganized schizophrenia, schizoaffective type. So next, waxy flexibility is motor disturbance that is predominant feature of catatonic schizophrenia. Waxy flexibility is motor disturbance that is predominant feature of catatonic schizophrenia. Next one, catatonic patients present two main types of picture. Catatonic patients presents two main types of picture. So they are catatonic stupor and catatonic excitement. Catatonic stupor and catatonic excitement. So next point, prolonged isolation can produce sensory deprivation manifested mainly by hallucinations. Prolonged isolation can produce sensory deprivation manifested mainly by hallucinations. So next question, next one. Depersonalization is a state in which the client feels unreal or believes part of the body are being distorted. Depersonalization is a state in which the client feels unreal or believes parts of the body are being distorted. Next point, looseness of association refers to sentences that have a vague connections to each other. Looseness of association refers to sentences that have vague connections to each other. So next point, echolalia is the involuntary parrot-like repetition of words spoken by others. Echolalia is the involuntary parrot-like repetition of words spoken by others, where echopraxia refers meaningless irritation of others' motions. Echopraxia refers the meaningless imitation of others' motions. So echolalia is involuntary parrot-like repetition of words. Echopraxia means meaningless imitation of others' motions, movements. So next point, direct questioning is the most appropriate technique to use when interviewing a client with paranoid schizophrenia. Direct questioning is the most appropriate technique to use when interviewing a client with paranoid schizophrenia. So for example, are you hearing voices right now? That is the direct question. So like this, we need to interview a paranoid patient. Next question, alcoholic beverages are contraindicated while taking an antipsychotic medicines. Alcoholic beverages are contraindicated while taking antipsychotic medications. So next point, bipolar affective disorder is characterized by cycles of extreme emotional high, that is mania, and loss, that is depression. Bipolar affective disorder is characterized by cycles of extreme emotional high and lows. So that is the characteristic feature of bipolar affective disorder. So next point, taking antipsychotic medication with milk, nicotine and caffeine will decrease the effectiveness. Taking antipsychotic medications with milk, nicotine and caffeine will decrease the effectiveness. So next point, referential thinking. Referential thinking means when an individual incorrectly interprets neutral incidents and external events as having a particular or special meaning for him. Referential thinking means when an individual incorrectly interprets neutral incidents that is not related to him and external events as having a particular or special meaning for him. That is referential thinking. So next is concrete thinking. Concrete thinking means it is the literal interpretation of words and symbols. It is the literal interpretation of words and symbols. So in research and all, that is concrete thinking we are using. That is the difference between referential thinking and concrete thinking. Next one, clang association. Clang association means it is the linking of words by sounds rather than its meaning. It is the linking of words by sound rather than its meaning. So similar words will tell the patients instead of its meaning. So for an example, patient will tell, the client may say, I like to drive my car bar tar far. So car, bar, tar are similar sounds only. There is no meaning for it. So that is the clang association. So linking of words by sounds rather than its meaning. That is clang association. So next one, abolition is the lack of motivation. The term abolition means lack of motivation. So that is a new term. Abolition, it is the lack of motivation. Next thing, alogia is also called poverty of speech. Alogia is also called poverty of speech, that is a decrease in the amount of richness in speech. Alogia is also called poverty of speech. It is a decrease in the amount of richness in speech. Next point, a flat affect is the absence of emotional expression. A flat affect means it is the absence of emotional expression. There is no emotional expression having the patient. That is called flat affect. So next point, haloperidol. Haloperidol is an antipsychotic medication. It is used also to control tics and vocal utterances that are part of the Tourette syndrome. Haloperidol, it is usually used as an antipsychotic medication and it is also used to control tics and vocal utterances that are part of the Tourette syndrome. So that is the another use of haloperidol, to control tics and vocal utterances that are part of the Tourette syndrome. So next point, never touch an agitated client. Never touch an agitated client. Touch can misinterpreted as the threat and can further escalate the situations. Never touch an agitated client. So touch can misinterpreted as a threat and can further escalate or increase the situations. That is important thing. So if the patient is agitated, do not touch that patient. It will misunderstand and patient will agitate more or they will attack the person. So make and convince the patient verbally. Do not touch the patient when he was agitated. So next point, fluphenazine. Fluphenazine is an antipsychotic drug that can cause photosensitivity and sunburn. Fluphenazine, that is used as an antipsychotic drug that can cause photosensitivity and sunburn. Next point, the prodromal, that is, or early signs and symptoms of schizophrenia may includes impaired role functioning and neglect of personal hygiene as well as social withdrawal and depression. So the prodromal or early signs and symptoms of schizophrenia includes impaired role functioning and neglect of personal hygiene as well as social withdrawal and depression. That are the early signs of schizophrenia. So we need to diagnose him as early so we can start the treatment. That is the important of understanding prodromal symptoms of schizophrenia or recurrence of schizophrenia. We can easily understand by these understanding these signs and symptoms. So next points. Disorganized schizophrenia is characterized by disorganized speech, disorganized behavior, and inappropriate or flat affect. Disorganized schizophrenia is a type of schizophrenia that is characterized by disorganized speech, disorganized behavior, and inappropriate or flat affect. That is the characteristic feature of disorganized schizophrenia. Disorganized speech, disorganized behavior, and inappropriate or flat affect. So next point. A client with ideas of reference mistakenly believe that other people's thought, speech, and behaviors refers to the client. A client with ideas of reference mistakenly believes that other people's thought, speech, and behaviors refers to the patient, refers to the client. So everything correlate with him by mistake. So he will think everyone is thinking about him only. That is the idea of reference. So next point. Polyuria and polydipsia are the common side effects of lithium that is used for mania. Polyuria and polydipsia are common side effects of lithium. So fluid and electrolyte maintenance is important in lithium patients with lithium therapy. Polyuria and polydipsia are common side effects. You need to check it that. So next point. Orthostatic hypotension is an adverse effect of tricyclic antidepressants. Orthostatic hypotension is an adverse effect of tricyclic antidepressants. So that is about this video. Thank you for watching this video, and don't forget to subscribe our channel, The Nurse, and please like and share this video with your friends. Thank you.